So I'm going to talk today about perimenopause, so that time around menopause, and we'll go through. Let's see if I can get it. There we go. We'll go through definitions of each of these things. Also, kind of cover common signs, symptoms associated with perimenopause and hormone imbalance. I'm going to introduce the steroidogenic pathway, not to confuse everybody, but just to show correlation. We'll also talk about lab testing. And then when I go through nutrition and lifestyle, as well as different nutraceuticals, botanicals that we can use, I show that steroidogenic pathway a little bit again, just so that you can see all the different links. And so I think it will be helpful in that regard. So definitions. Perimenopause is basically describing those years encompassing menopause. So on average, it can be anywhere from 4 to 8 years. And I know people kind of want to know where they are, how long is this going to last? And it's really hard to predict. But I have a couple of different screens here that'll show you some timelines. Premenopause is in those years preceding menopause. Menopause is defined as that 1 year after your final menstrual period. Average age for menopause is 51. Perimenopause generally starts in 40s, can start in 30s for some people. Postmenopause would be those years beyond menopause. And to think about what's really happening during that time, we really have declining hormone production and transition from ovarian hormone production to adrenal production. And that, of course, probably makes things really clear. And one way I like to look at this, because I feel like menopause has really gotten kind of a bad rap over time. And unfortunately, I think that that's related to early on having a very male-dominated culture, questioning women's values if they're not reproductive, and also pharmacy, because they've got drugs to sell to help us with this deficient state. So thinking about it, I like to kind of think about, life is all circular. So we go through those early years of being dependent when we're, at birth up until we kind of start to hit puberty in our reproductive years. And there's this independence then from a life standpoint. And we move into these reproductive years, and women often then, spend many, many years being caretakers, and really the focus for a lot of women, whether you have children or not, I think is really on caring for other people and less time caring for themselves. And I think that that's just how it works. And it's part of the role we play. But once we go into menopause, rather than thinking about that as this state of lack of hormones and these different things, like really it's this really actually cool transition where women, if you think about as we go into menopause at the age with which that happens at, children are grown, maybe we've advanced to a different phase in our career. Many women in menopause start to find their voice. That was looked upon negatively for many years. Because, I think years ago and traditionally men didn't really want to hear from women so much, but, we find our voice, we start to focus on our own self-care and really start to think about like, boy, what do I want to do when you're not focused on taking care of everyone else around you? So in that standpoint, I think it can be a really cool time. And I like to think about it in that way. In terms of postmenopausal, certainly there are things that we want to avert and avoid. with some of the symptoms that can go along with that. And for the most part, I think we can do that really quite well. When we look at kind of the timing of what happens, you know, we have regular cycles, and then initially our cycles start to become more irregular and have different, you know, we can get some hot flashes, they can be cyclic at first, different symptoms can happen along the way. And the further we get into this whole perimenopause, you can see the hormone fluctuation changes and then eventually goes down. And that's part of why sometimes when we talk about labs, it's really difficult to predict where am I at in the process. You know, we don't have a great way to do that other than really looking at a combination of things. We try to get a good idea. So common signs and symptoms associated with perimenopause, you know, irregular periods, hot flashes, night sweats, sleep problems, mood changes, vaginal dryness, bladder problems and incontinence, certainly decreasing fertility, changes in our sexual function, bone loss, changes in our cholesterol level. So lots of these things related to fluctuating hormone levels and just changes. And again, I wouldn't say they're all negative changes. And, you know, just to think about signs and symptoms of a hormone imbalance, because that's certainly what is happening in that perimenopausal, but think about in years, in younger years as well, like different signs of hormone imbalance, you know, the mood swings and breast tenderness and periods that are real heavy and cramping and even things like anxiety and different struggles with energy levels, hair loss, brain fog, all these different things are things that we think about with hormone imbalance. And so that is what is happening when we are starting to deal with perimenopause, certainly. There are some risk factors for earlier perimenopause. Number one is smoking. And that's pretty interesting that those who smoke tend to go into menopause 1 to 2 years earlier. Family history, often I will ask, you know, do you know like a mom, a sister, you know, at what age do others go through menopause? And that sometimes will give us a clue, but it's not hard and fast. Certainly cancer treatment if somebody's had chemotherapy, radiation. If people have had a hysterectomy, even without having your ovaries removed, you can go into menopause earlier. Autoimmune, there are definitely autoimmune issues and toxins. And I'll spend a little bit of time talking about toxins and the role. That certainly is playing more and more of a role for all of us, I think. When we think about different hormone disruptors, so others thinking about things that would lead to early perimenopause, thinking about different things like nutritional insufficiencies, the genetics, we talk about that with family history, insulin imbalances. So diabetes is a big thing, poor diet, alcohol and smoking, food allergies, sensitivities and intolerances. Another big thing, inflammation, infections, different detox capabilities for each of us play a role. Poor sleep and chronic stress, as well as increased fat storage, and then different GI problems as well, will all lead to hormonal dysfunction or certainly can play a role. And so you can see when we talk about this, there's such a balance. And I think when I talk with people about hormones, you know, I tend to state, you know, if we have blood sugar imbalance, that's one of those things we got to fix before we can really dive into hormones, because it's just kind of one of those underlying things that we have to address. So getting into lab testing, this is the steroidogenic pathway. And for many of you, we've looked at these before with different testing, but interesting things to think about and understand. Cholesterol is where this all starts. So we do need some cholesterol, and cholesterol is what, you know, leads to get us our progesterone here It helps with, our DHEA. And without this, we got to be able to produce testosterone as well as estradiol, and then we get all the breakdown things. And so I'll show in some different pathways how different things impact this. So common testing that we will do when we're thinking about hormone evaluation, menopausal evaluation, and certainly looking into different symptoms that you might be having. For blood testing, basic blood count and metabolic panel, fasting insulin is very important to know how we're doing in terms of blood sugar balance, hemoglobin A1C. Thyroid function is really important, because if we are dealing hyper or hypothyroidism, that is very much so going to impact our hormones. And looking at different hormones, whether we're looking at estradiol and testosterone, progesterone, DHEA, FSH and LH will change through time, as well as maybe an AM cortisol if we're looking at stress. A couple of other ways we look at some of these things, sometimes we'll do saliva testing. Mostly, I would say I use that for adrenal function testing when we're looking at cortisol and impact on stress, but we certainly can use that with hormones as well. And urine testing, there is some dried urine testing, what we call a Dutch test. And that's actually really interesting because it really looks at hormone levels. It looks at them indirectly because we're not looking at blood or serum levels, but we also get a chance to look at metabolites and how you process things. So there are definitely some advantages to that. And generally, we're using a combination of these things. Dutch also gives us a good look into cortisol as well. And so I would say, if I'm looking at more adrenal function, probably saliva or urine tend to be more helpful. And the testing can be helpful in identifying imbalances. But you have to look at it with signs, symptoms, and it really doesn't give us, well, here's where you are in the process. And I think you can appreciate that from a couple of the other graphs that I shared. Like, it's, there's a lot of educational guessing and timing of things that we can kind of gauge maybe where you're at. So some different, it's pretty interesting because there's definitely lots of tools we can use to manage symptoms and ease your transition. And again, this is one of those, it's that steroidogenic pathway again. And I don't, a lot of doctors are afraid of this, and we really look at this from a functional medicine standpoint. We use a mnemonic called PTSD. And so it's production, transport, sensitivity, and then detox. And there's kind of a joke that it causes PTSD when we're relearning this, because this is one of those biochemistry things that we learn early on in medical school. And certainly at the time that I was in medical school, they were like, oh, you just got to learn this stuff once, you'll never use it again. Well, it turns out if you actually want to help people, you probably should use it. But there's different things. And so the importance of this, and you can always go back and look at this, and maybe I'll share one of these in my follow-up email, but you can see how different things can impact different areas along here. So if we're having issues, and say you have, from a progesterone standpoint, we need progesterone to create the rest of our hormones. We also need it for our cortisol. And so for our adrenal function, one thing pretty common that people can be on are some of these proton pump inhibitors for heartburn and reflux. And those will get in the way of creating cortisol. And so it's pretty interesting when we start to look at those things. And when people have diabetes, that inactivates. And so there's all these ways we can kind of push and pull different pathways that we need to. In terms of nutrition and dealing with this, really basic dietary approach, plant-based diet, and this is something that we talk about often: limited animal proteins, grass-fed, pasture-raised meats, wild-caught fish, limit sugar and alcohol. That's pretty standard about what we talk about. It's really eliminating these processed foods. And then we'll talk about toxins in a bit here as well. In terms of beneficial foods supporting estrogen metabolism, I'll talk about this again later as well, but cruciferous foods. So basically your cauliflower, broccoli, Brussels sprouts, kale, trying to think what, that's probably most of the main ones. Asparagus can help, but fresh greens, vegetables, fruits, legumes, beans, legumes, and we'll talk about soy here in a minute, but bean seeds, nuts, flax is really helpful. Whole grains, flax, olive, and sesame oil, green tea is very beneficial for multiple things. And when we talk about soy, there's controversy around soy. And soy actually works as what we call a phytoSERM, and that's a selective estrogen receptor modulator. And so to not get too deep into the weeds, we have a couple of different estrogen receptors in our body. We have alpha receptors and we have beta receptors. Alpha receptors promote proliferation. So if you think about in our breast, if you were to take oral estrogen, we need to be very careful because it potentially is promoting proliferation, and that is not what we want to do. These soy actually works on beta receptors, which actually are protective and do not promote proliferation. So that's an important thing. There's different things we can do to modulate different receptors, but the concept that soy is bad is it's not accurate, really. And one important thing to think about with soy is buying non-GMO, and unfortunately 90% of soy is probably genetically modified. So, but you can find non-GMO soy. And it's not to say everybody needs to go on soy, but don't live in fear of it, because it's not dangerous in general for you unless you have an allergy or there's another specific reason we would want to avoid it. And then I thought I would just put in, like, there was a position statement paper in 2016 really addressing soy, and actually one of the things in soy is its isoflavone content, and it's actually found to have preventative effects with respect to breast cancer. So if you talk about it and somebody says you can't eat that, you can always say, like, well, wait a minute, like, I did learn that there are some different things out there. In terms of lifestyle factors, it's pretty interesting how we can help use, and I'll break down each of these, but how meditation can help promote DHEA, whereas stress, smoking, and aging will decrease that production. Lots of different things to think about, again, of just about stress. What are the benefits of exercise? What are the negative aspects of a standard American diet, which is full of really lots of processed food and not what we're striving for as a goal. In terms of movement, definitely benefits to balance hormones, sugar, blood sugar, weight loss and management, bone health, mental health benefits. And those are all things, that we worry about through a lifetime, but we're certainly worried about those postmenopausally. Aerobic activity, goal of 150 minutes a week of moderate activity. If you're doing more intense activity, certainly the minutes can go down, but I would say shoot for at least 30 minutes of activity each day. Interval training, that's kind of that higher intensity. That can be done a couple of times a week. That can be as simple as being out walking and picking it up for a minute or two and then slowing your pace back down. And we can do that all the way up to where you're doing sprints on a treadmill or on a bicycle, those different things. Strength and resistance training, super important. It does not have to be very involved. Major muscle groups, one thing that we talk about often is the key 3 exercises, which are squat, a chest press, and a single arm row. Really can be simple, 2 to 3 times a week. And that's really going to go a long way in maintaining, all of these things, and really some activity to help with bone loss and And so if somebody's a cyclist, we still need to do resistance training. It's still probably good to get out for a walk because you do need that weight bearing activity. In terms of sleep, benefits of hormone and blood sugar balance, energy, mood. Our goals are 7 to 8 hours at night. Ideally, I want you to wake feeling rested. If not, we need to look further at the sleep. One clothing tip for sleep, especially if you're struggling with hot flashes, is to be in breathable pajamas. And so, what does that mean for me? So that breathable basically means like the same kind of material that I would run in for a shirt, breathable. So polypro, something like that. Or, wool is great. Cotton tends to soak up sweat and heat and not dry out. So things that are going to be able to help with moisture management are often very helpful. In terms of stress, stress plays a big role in our hormone balance, our blood sugar, our mental health, and our weight, because stress certainly drives insulin. It drives cortisol. That drives belly fat around our midsection. And that can all spiral to create more hormone imbalance. Tools to manage stress, certainly prayer, meditation, journaling, exercise, reading, spend time with people that you love and that you like to talk to, vacations, be it puzzles, just different things. Something that is relaxing for you, I think, is really important. When we talk about things like meditation, you don't have to be doing things for hours. That can be walking meditation, just like prayer. I would say get outside. That's a really important thing for all of us. One plug here for acupuncture. There's definitely data to support that for sleep, hot flashes, stress management. So and most of I'm a pretty big fan of acupuncture. So I think that can be really helpful tool, and it's relaxing. So talking about toxins, interestingly, you've probably heard over time that the average baby has over 200 chemicals in their cord blood, which is a lot of toxins, when we really think about it. And women, especially when we look at makeup and stuff, women put over 150 chemicals on their faces every day. And we have to be mindful of those things, because some of those things certainly, I think the longer that we are here on Earth, and over time, and certainly over the lifetimes that many of us have had, there are just more and more toxins that we need to be aware of, and that are cumulative. And we're seeing the impact in children as well, with early menarche, or when they start their periods earlier, and we're seeing more fertility issues and all of those things in just our general population. And when you look at different toxins, there are different things like PCBs, that's in electronics, it's in oil, like different things, but those have negative effects on things. Pesticides are really unhelpful, and even thinking about medications, certainly diabetes has negative impact on our hormones. Birth control pills have negative effect. We have to think about things like metformin, different blood pressure medications, our proton pump inhibitor medications. All of those things can have negative effects. I mean, they can kind of have both effects, but certainly some negative effects as well. A couple of different tools, and I talk about these, and I'll answer questions here in just a minute. Things to avoid chemicals. Triclosan now is banned. That's kind of what was in the antibacterial hand soap. So like if don't buy antibacterial hand soap, just buy hand soap or just soap. The Think Dirty app, a lot of you guys know I like the Environmental Working Group app. They have the Dirty Dozen, Clean 15. They've also got Skin Deep as an app, lots of different things where you can just scan barcodes of things and learn about the environmental impact, as well as different, how carcinogenic is this for me and those kind of things. And really particularly too with cleaning products and sunscreen. So think about that. But also, thinking about what foods do we need to eat organic, different modes of transportation, cleaning products in our homes. And all of those things to avoid chemicals are also the same things with fetal exposure, like cell phones, Teflon coating in cooking, in pans and in utensils, plastics, fragrances, all of those different things. So we need to be really mindful of what we're using and bringing into our homes, and I guess to our workplaces as well. In terms of different nutraceuticals and botanicals, lots of different things that we can use to modulate basically our hormones for, to treat against adverse effects that we're having. We talked a little bit about green tea already, super helpful, but other things, soy we talked about. There's things like resveratrol and hops, and basically our cruciferous vegetables and berries. Broccoli sprouts is a really great thing. So lots of different things, and flax, rosemary when you're grilling foods or cooking, that can make a difference. So lots of things to kind of dive into and look at here. And certainly on an individual basis, we can address different things. And in general, lots of different nutraceuticals and botanicals to support estrogen metabolism. Number one, vitamin D is really important. We've talked about vitamin D a lot in our immune support, but vitamin D plays a big role in our hormones as well. Cruciferous vegetables, that basically can help us create safer estrogen metabolites. B vitamins support methylation. A multivitamin with some detox support in it will help our liver to be able to detoxify things. Calcium D-glucarate is a supplement or nutraceutical that can help process that estrogen and excrete it out of our gut. NAC, which is N-acetylcysteine, we've talked about that with regard to immune support. It supports detox. Antioxidants, so fruits, greens, simple things like vitamin C can be helpful. And magnesium, which is generally helpful for just about everything. Magnesium is helpful for in terms of bowel health, but also in terms of metabolic pathways. Oh, no, there we go. Supporting progesterone. Few different things, use of organic meats without hormones. Vitamin C is helpful. Vitamin E can be helpful. Vitamin B6 can be helpful. Black cohosh can be helpful with supporting progesterone. So lots of different things. And the fun thing is there's lots of foods that we can work with that are really helpful. In terms of medications, and we're kind of close to wrapping things up here, and I can take questions, but medications, we're really looking at bioidenticals, and we're looking at more conventional medications. So in terms of bioidenticals, estriol can be used. Topical is preferred. There are some increased risks with oral. Estrogen, progesterone, this one can be used orally or topically, and that becomes a bit more of a preference. It's often helpful with anxiety, sleep, bleeding issues. DHEA can be used orally or topically. That will help just support our estrogen and testosterone further downstream. It helps with a sense of well-being. Also really effective for vaginal dryness. And especially for someone who maybe has had breast cancer or other hormonally related cancers, DHEA can be used safely. In terms of different conventional medications, certainly hormones are used, and there are some conventional bioidenticals. So there are some bioidenticals that I can prescribe, or any provider can prescribe, that you can pick up at the pharmacy. A lot of synthetics are still used, unfortunately, and there are definitely risks associated with that. In terms of other drugs used to treat hot flashes, there's different antidepressants that are used, anti-seizure medications that are used. These are generally being used off-label, as a lot of them are not FDA approved for this, but sometimes effective and sometimes given other other personal history things where maybe there is a contraindication to hormones or other things, and we can't control things with diet and nutraceuticals or botanicals. Sometimes those are helpful things. So just in wrap up, we really have a fairly complex hormonal system, and complex in a neat way, because when you start to dive in and you break things down, there's a lot of ways to modulate. And so I don't take that as a negative. There's lots of things we can control in terms of diet and lifestyle. Lots of great support in terms of supplements or nutraceuticals, botanicals, and medications if we need. And then really lastly, think about the cycle of life. And I really like to focus on the positives when it comes to menopause, because it's really a time for all of us to really come into our own, which I think is a really neat opportunity. So I really like to look at it favorably, whereas I feel like the media sometimes does not necessarily do that. So references I used, I had a great review of my past hormone advanced practice module through the Institute for Functional Medicine. There's a pretty helpful basic couple pages on the National Institute on Aging. And then there's an interesting article in The Atlantic from 2019 about the secret power of menopause that I think a lot of you would find interesting. And with that, thank you.